Hi, I'm Dr. Neil Floch, and I want to thank SAGES for allowing me to speak today at this virtual meeting. I'm going to be talking about SAGES social media in surgical practice. I have nothing to disclose. I want to let you know that I became involved in social media for a couple of reasons, and I've found out that social media is a great way to both educate, communicate, and collaborate with my colleagues. I had a desire to educate others and learn as well about surgical treatments and issues. I personally wanted to increase and help surgeons use social media and especially Twitter. But I also wanted to unite physicians in a common goal online. Social media has been able to allow me to do this, and I hope that you find that you will become more involved and it will allow you to grow as well. So the uses for social media in surgical practice are many. And if we break them down into categories, for education, it's learning to treat patients better. Basically learning about cases, learning about information. As far as journal articles, we can learn from journal articles, but we can help to promote them and learn from reading. And we can also learn from the commentary of journal articles as well. We have been able to perform global project collaboration, especially with COVID-19, whether it's during research or meetings or this life-altering event that we've had with this pandemic. And lastly, we'll talk a little bit about marketing your practice. I'm addicted to information, not Twitter. I'm addicted to the information and the knowledge that Twitter brings me. And this brings us to how do we educate? Well, we educate, we get information from other physicians, but we also read journal articles and books. And this is how we have done it in the past, and many people continue to do it. It's the people that they interact with during the day or who influence them that teach them. Social media will allow you to do this much greater. And since the advent of social media, we now have applications such as Twitter, where we can communicate with other doctors we have never met. We can talk about good tweets. We can talk about how to tweet information. We can talk about tweeting articles as well. But it's that collaboratory ability that really enables us to learn and to gain information. Actively performing during the day on social media is something that people differ in. Some people like to be more passive, and they may read their tweets or read their Facebook or Instagram, or whether it is other social media applications as well. And they may follow people, but they may not be that active. It is also an excellent opportunity to be extremely active, whether it's advocating for a treatment, whether it's tweeting your own microblog, whether it's coming up with your own tweets, teaching, building a program around Twitter, which some have done. There's a lot that can be done with this social media application. On Facebook, we can also learn, and Dr. Ganem earlier spoke at this meeting about Facebook groups, and I won't get into it too much, but at the ASMBS, we have a Facebook group as well as SAGES, and we also have a discussion monthly on articles coming from SWORD, so we have a journal club as well. A lot of these discussions occur on these Facebook closed groups, but if you're HIPAA compliant, and you can present cases if you have patient's privilege, and because there's so many physicians participating on Twitter, and you don't need to be part of a closed group, you can get a lot of information about a clinical problem very, very quickly. It can be very clinically helpful in a difficult situation, especially if there's a rare disease and not many people know about it. This is an excellent way of reaching out. I must emphasize going forward that you must be careful what you tweet, okay? It is very important that you have patient's consent if it's a specific or unusual case condition. The common cases, such as appendicitis or cholecystitis, are rarely concerning. But if someone has a rare disease and they look on the internet and they look on social media, they may find themselves being presented. And this no longer is acceptable. You need to get patient consent. You must also be professional. Be as professional as you are in your career on social media. It's no different. And the factability of information. Is this medical evidence? Is it good medical evidence? Well, most patients and the public are not aware the difference between anecdotal opinion, expert opinion, and then the studies that we have and the increasing amount of significance of medical evidence. Systemic reviews and randomized control trials being at the top. So we need to also understand this. Your education can come from particular tweets of information that are coming from all over the world. And this one group from Colombia has done a fantastic job of teaching doctors about clinical information from journals, from books, and actual operating room experiences. They've done a model job. So you can read videos, you can read articles, you can watch videos, and you can also learn from the experienced commentary that comes from these articles once they are posted on Twitter or Facebook, etc. We also gain a lot of education from meetings and presenting the presentation slides of individuals who are speaking live. This information can be looked at a later time. It can be categorized according to hashtags. There can be a synopsis of the talk in one of the slides, and it's always great to show a good picture of the speaker. I present this because this is a model educational tweet from the meeting. Previously, we were unable to see information unless it was presented to us live. We would actually need to go in the operating room and watch a case if we wanted to learn from it. No longer is this necessary. Crowded operating rooms like you see here are a thing of the past because we can look at an operation online at home at 3 in the morning and we can learn from it. So education has changed and YouTube has done a great job of doing that. Journal articles will help to promote research. And research potential contributions from social media are many. Social media can help to connect investigators with common interests. It can fine-tune the scientific questions that we ask in a study. It can help people in the clinical trial networks get support and help to support the growth of that trial by recruiting patients for it. There is patient-reported outcomes research. There's information sharing and knowledge dissemination that has occurred like never before. We can also promote our research, and there are many studies that I'm about to show you. There's increased visibility of the surgeon and scientific professions as role models, and we can do a great job on Twitter by presenting a lot of this information. This is actually a randomized trial showing 112 papers which were randomly chosen, shared by a group with 58,000 or more followers. And the patients that were tweeted by this group accumulated 4 times more citations than non-tweeted papers. Now, mind you, this is just tweeting the paper, nothing else. We know from our experience, or my experience with the SWORD journal, that if you tweet the articles and you tweet them with a graph or some other information, that those articles will be more looked at more than the other articles. Stepping up from that, if we add a picture, studies have shown 37% more retweets when a picture is added. And with the advent of the visual abstract by Dr. Ibrahim in 2017, we can now see from this visual abstract of papers disseminated by visual abstract, we see that these tweets of articles have 7.7 times more impressions. These visual abstracts about articles have 8.4 times retweets, and the actual article that is attached to the visual abstract will have 2.7 times more visits. Promoting our research is very important. And one of the best ways to do this, according to Magdalena Skipper, she is the editor-in-chief of Nature, one, if not the most influential journals there is about science and medicine. She has noticed that these Twitter threads tell a great story and a narrative and are an effective way of promoting and explaining your information from a study. By linking together several tweets, you can give a narrative and explain. You can also use pictures to do it. It's a wonderful opportunity. Global collaboration is one of the greatest advantages of social media. And with this, it must be give and take. We must work together. It's been said that you can't herd cats, and doctors are like cats. But with social media, we have overcome this. We give, we receive, and we engage in a community where anything is possible. Such as articles like this going on right now, with over 409 participating surgeons in 58 countries and in 925 patients in this bariatric surgery COVID-19 trial. So engage, collaborate, work together. Projects are performed without ever meeting another surgeon or collaborator. Research papers have been written. Professors and medical students alike, at different levels of their training, authority, experience, are equal on social media. They are collaborators. It is the great equalizer, and it has become valued for your ability to contribute, not your stature in your profession. Bonds have formed now between individuals who have never met, and sites such as social media for surgery or Med Twitter are great for doing this. We need to communicate, and hashtags are great for that. In the COVID-19 pandemic, we needed to create a hashtag that would allow us to communicate better. So I put out a Twitter poll to see which ones people think would be most popular. And we started to use it and to communicate on it. Communication in these times is quite important. And the common phone call and text, although one individual can be talked to and several can, it's not as easy as on Twitter or other social media applications. There was a need for immediate action. There is a need for extensive communication and collaboration. This did continue, though, in large groups that were on both ASMBS sites, SAGES sites, LinkedIn, Facebook groups, etc. These were excellent in helping individuals collaborate during the COVID-19 pandemic. You can see action occurring here between these two tweets where Dr. Hennerford and other individuals in the COVID-19 group were discussing protocols, changing them, and collaborating. On WhatsApp, many individuals in private practice were discussing how to work through some of the problems there were facing those individuals affected with the pandemic. And the greatest collaboration occurred with open access journals, where many individuals across the world came together and we formed a pandemic surgery guidance paper, individuals who have never met. And we did so much positive work in creating this paper in 5 days, other individuals. So Twitter chats are an amazing way to advocate, collaborate, and discuss among the global community involving all individuals. Obesity social media was started by myself and several other individuals, initiated by Heather Logie, who drove the beginning of this discussion about obesity stigma, myths, and the surgery itself. In a Twitter chat, it's 1 hour long. We have ours on the second Sunday of every month from 9 to 10 o'clock. We write a blog, it goes on a website. There are 5 questions. Every 10 minutes or so, we ask another question, we discuss it. The tweets go out. They go out to a small group, but as they get retweeted, reliked, this gets much bigger and bigger, and the message gets spread. The average impressions of our tweet chat run at about 10 million. Collaboration amongst individuals is now becoming a social science, and seeing what groups communicate with each other. By looking at these nodes, you see there are 4 groups. Dr. McKenzie is an expert of this out of the United Kingdom, and basically the collaboration among groups can be studied. Who's communicating with who? And we can learn a lot from how we can better communicate with individuals. So marketing your practice, all of the discussion I've talked about will help to promote you and your brand as a physician. But specifically marketing the practice comes with a great website. Also, specifically on social media, there are media applications that you can use to promote your site. Much like a website is a basic Facebook page, it can be more dynamic and interactive than a website. You can post the best from your practice site about patients, recipes, blogs, and events. It is important that you participate in social media. Having your marketing team do it is not as significant as you, because your influence, reputation, and visibility are key to promoting you as a physician, you as a surgeon, and your practice and what you do. When it comes to bariatric surgery, which I perform, the greatest thing is the before and after picture. So the greatest social media application would be Instagram for that, because it helps to promote pictures. And there are many hashtags for which other individuals and patients can see. It is a great way to get exposure. So, but your social media application, what you're comfortable with, may be different than I. Everybody has a niche. It may be LinkedIn, it may be Facebook, it may be YouTube doing videos, or Twitter. We only have so much time in the day to dedicate, but you've got to get involved with something. If you don't get involved, well, you'll be involved because you're out there. This is a Facebook group. They're discussing who to go to for the gallbladder. This patient came to me, it was sent to me through this Facebook group. So you're being discussed. Social media can help grow your practice, help you educate, communicate, and collaborate, and help you to grow as a physician. You want to join Twitter, LinkedIn, or other social media sites, tweet what you're interested in, and tweet your research, definitely. Call out colleagues by tagging them, use diagrams and pictures and visual abstracts if you can. Be original. People want to see something new. Be entertaining. People want to be entertained. dispute medical misinformation, and participate in the communication of good evidence. Social media can be used to educate others now and help your practice grow. It can help to do it in the future. The future is now. Work on it, get it done, and help yourself and your practice grow. I thank sages, and hopefully everyone can be happy and we can get through all that's going on in the world right now. Thank you.